Hello dentists, how are you today? Today we're going to talk about dental implications of the following findings in patient's history. So when we take a patient's, when we take a good case history, we have to ask the patient what type of medication is he on, and the if he is diabetic or hypertensive, or he has any medical conditions, okay, like for example angina, infective endocarditis, osteoporosis, and so on. We're going to talk about these in details, okay, and the effect of drugs they are taking on this patient. So let's start now. Patients with angina, of course, they take glyceryl trinitrate, okay. Patients with diabetic patients take insulator, okay, which is insulin, okay. Hypertensive patients take nifedipine. Infective endocarditis, patients with infective endocarditis, we're going to see the effect of drug on this patient, okay. And also we're going to talk about patients with osteoporosis, okay, having biphosphonate, okay, tablets, or taking biphosphonate tablets, okay, or fosamax, 70 milligrams. Okay, let's start with the angina. Patients coming to the clinic having angina. So what is angina? Angina is a type of temporary chest pain, pressure, or discomfort. Okay, so the patient will feel pain in the on the chest. Okay, it is due to the narrowed artery, and what happens ischemia. Heart muscles is not receiving enough oxygen due to the narrowed or coronary artery. So this is angina. Of course, we're going to talk about patients coming to the clinic with angina. Dental implications of the following findings in patient's medical history. Let's start with the patient with angina. This patient takes glyceryl trinitrate, and this GTN is a vasodilator. So glyceryl trinitrate is a vasodilator, and it reduces the left ventricular work by reducing the venous return. Therefore, it is used to provide symptomatic relief in angina. So the function of this this drug is provides symptomatic relief in angina. Angina occurs when there is an imbalance between the demand and the supply of blood to the heart, and the patient experiences crushing central chest pain that can radiate down to the left arm. So he will feel pain in the left arm, okay. Chest pain that will radiate will reach the left arm. An attack may be precipitated by dental treatment, reducing stress by providing good anesthesia and not subjecting patient to long appointments will minimize the likelihood of the patient having an attack. In addition, the patient could take GTN at the start of an appointment. So here, in order to avoid any attack in the clinic, okay, we have to make certain precautions when this patient comes to the clinic. So what do? We can give him GTN at the start of the appointment in order to avoid the angina attack, okay, in order to reduce the stress by providing good anesthesia and not reducing patient to too long appointment to minimize, which will minimize the likelihood of patient having an attack, okay. Next patient having diabetes, okay. This is a dentist with an old patient, and patient is taking insulated. What is insulator? Is an insulin preparation that is used to control the blood glucose level in the patient with insulin-dependent diabetes mellitus. Patients self-administer insulated subcutaneously. Diabetic patients have poor wound healing and are more susceptible to infection. Hence, they are prone to gingivitis, rapidly progressive or progressing periodontal disease, and oral candidal infections. Okay, so this means that the patients, diabetic patients, has poor wound healing. So it's not for extraction. It's very important to know the reading for the sugar or glucose level. Okay, the blood glucose level in order to, if he's going to make extraction or any other dental procedure. So diabetic patients have poor wound healing and are more susceptible to infection. Hence, they are prone to gingivitis. So they get gingivitis, rapidly progressing periodontal disease, and oral candidal infection. So he will be prone to these things. Okay, they may also have xerostomia, also dry mouth. Treatment should be timed so that it does not interfere with the meal time, as hypoglycemia may develop and the patient may collapse. So it's very important to take care that the treatment time management, okay, for this patient, especially in order to avoid collapse in the dental clinic. Hypertensive patients, as we can see, patient is taking nifedipine, of course. What is the function of nifedipine? It is a calcium channel blocker and used to treat hypertension. So hypertensive patients are at increased risk of other cardiovascular disease. Routine dental treatment may need to be postponed if the patient's blood pressure is greater than 160 over 110 milli. Okay, so it's so if the blood pressure is high, we have to postpone the dental treatment. Hypertensive patients are more likely to have excessive bleeding following extraction, so it's very important to postpone the patient until his blood pressure is normal. Okay, nifedipine can cause gingival hyperplasia. This is one of the side effects of nifedipine, which is used for the treatment of patients with hypertension. Okay, so it's one of the side effects of nifedipine. It causes gingival hyperplasia. Okay, swollen gingiva with bleeding gums. Okay, infective endocarditis. Patient coming to the clinic with infective endocarditis. What is infective endocarditis? It is the name given to the condition in which there is an infection of the heart valves in the endocardium, or the inner lining of the heart. Okay, so patient has had infective endocarditis in the past but is not allergic to penicillin. So patients who have had previous endocarditis and are no longer given antibiotics cover prior to dental treatment. It's thought that maintaining a good standard of oral hygiene and dental health is more important, as bacteremia can occur following chewing and toothbrushing and not just invasive dental treatment. Okay, so it's very important to know here that patients with who had infective endocarditis are no longer given antibiotics prior to dental treatment. Okay, this is a very important point. Okay, let's go to the next. Patients coming to the clinic with osteoporosis. Okay, this is a healthy bone. Of course, it's found in old age. Patients who has osteoporosis and is taking biphosphonate tablets or fosamax 70 milligram once a week. Those patients take biphosphonate are at greater risk of getting biphosphonate related osteonecrosis of the jaws, which we call it bronch, and this may arise spontaneously or following dental treatment, especially extraction. So it happens after extraction. In terms of dental treatment, it is important to make sure that dentures fit well and are realigned if necessary, as trauma may lead to bronch. Routine dental treatment can be carried out with little likelihood of risk. Extractions may cause bronch. However, the risk is very low, and hence it may be advisable to restore the teeth rather than extraction. If extraction cannot be avoided, then patients should be informed about the risk when the consent is to be gained. Okay, so we have to make a constant for this patient. Okay, and it may be advisable to limit the extractions to one quadrant at a time and wait for sockets to heal fully before moving on to the next quadrant. So this is very important because of the healing process. Okay. Okay, today we talked about the different patients coming to the clinic that are on medication, and what are the side effects of these drugs and the importance of these drugs, and what should we do in the dental clinic. Thanks for listening today, and I hope that it was interesting, and study hard, and thanks for listening, and goodbye for now, and subscribe to my channel and hit the notification bell for more videos. Thanks for all of you for your support. I really care about you all. Okay, thanks a lot. Bye for now.